Hello, everyone. Welcome back. My name is Pam Roussel with Perfectly Holistic, and welcome to the radio show. We are so excited. We have such an amazing show tonight, and I have to say, it's probably the highlight of the year. So if you are tuning in, you guys are in for a super treat. If you are watching us tonight, we are streaming on Instagram. Remember, we can't see your comments, but hop on over to YouTube or Facebook. If you want to drop a comment, let us know that you're here so we can say hello. And I want to welcome my very special guest, Dr. Richard Pitcairn, the most renowned, beloved homeopathic doctor, vet, professor, teacher, probably in the world. And we are so honored that he is here to teach us about vaccinosis in pets, which is a real thing. So, Dr. Pitcairn, thank you so much for being here.
Well, thank you. Wonderful introduction.
Well, it is much deserved, I have to say. We are just delighted that you are here, and one of my whole platforms is just empowering pet parents so they can learn how to apply a more holistic approach with your pets.
Yes.
And homeopathy is one of my favorites, and it's so easy to use, but a lot of people aren't familiar with it, or they're not very confident with it. They haven't learned very much. But one of the main issues I wanted to talk about the topic tonight is because there is an over-vaccination problem around the world. Mm-hmm. And what we're seeing is chronic diseases and illnesses in pets. And a lot of that, if vets are open-minded to look behind the curtain, a lot of times this can be linked to vaccines. And so with your knowledge and what you've studied in immunology and in practice that you've seen with pets, you've done so much research and you've put so much valuable information together that I've personally read and found so much helpful information and insight that blew my mind, actually. So thank you for sharing this information tonight. Where should we start?
Well, let me introduce what I was thinking of talking about tonight. First of all, this is what we're calling vaccinosis, and we'll explain what that is. It's a very important topic. So it's good to bring it out. But it's also a topic like this is also a difficult one in today's culture. Mm-hmm. We know that talking about vaccines in any way that would seem to be saying that they're not performing well or a problem is censored and you're criticized for it. It's a tough one to present. I appreciate that people are willing to listen to it. And what I'd like to do is say to those that will be listening to this, don't take the position of looking at it right or wrong. Just see what you can learn from it. Let's learn about vaccines and what they, I'm going to start with the very first one and how even with the first one, there were effects from them that we're seeing. And it's continued ever since. And yet, talking about those effects is pretty much put down, and there's a very strong allegiance to vaccines by our culture, and I'm going to try to explain a little bit why that is, and we're going to go into then what was discovered in homeopathy about vaccines, because homeopathy had developed a deeper understanding of what we're dealing with. Mm-hmm. Okay, so let's jump into it with the first slides there. Excellent.
Go for it.
And so I'm going to talk about smallpox. Smallpox was the first vaccine for those of you who didn't know. And I'm going to just talk briefly about smallpox because I want you to realize I want to have a communication that it was a very serious problem for humans. And that the doctor that developed the vaccine was very smart and very brave to do that. Okay. Now we'll find that there might be some issues associated with using. Nonetheless, what he discovered has had profound effects on our experience of this disease, which we'll get into. Okay. Mm-hmm. So the history of it briefly, smallpox, as far as we can tell, originated thousands of years ago. That's amazing.
Yeah.
It's been thought that Egyptian traders brought it to India, that it's been an endemic human disease for at least 2,000 years. It's hard to
Wow.
believe. It was probably introduced into China during the 1st century. The 6th century, it went to Japan from China. And when it entered Japan as a disease, the epidemic they had there killed 1/3 of the population.
Wow.
1/3 of all the people living in the country.
Wow.
Yeah. So let me show you some pictures here about it. I'm doing a lot of that, I know, rather briefly,
You're
but
good.
it's an amazing story. So first of all, here, in the mid-18th century, which is when the smallpox vaccine was developed, it was a major endemic disease. An endemic disease means it's always present.
Mm-hmm.
And it was everywhere in the world except Australia and the small islands that had not been explored. Because when it was introduced to a country, as I described, going into Japan, it had tremendous impact. In fact, when the Spanish came to the Americas and they started to fight the Indians, they introduced smallpox, and that's what decimated the Indians, and they couldn't fight back. It's amazing.
Mm.
So anyway, in Europe, in the 18th century, it was the leading cause of death, a leading cause. 400,000 people died every year from smallpox. And 1/3 of those that survived the disease went blind.
Wow.
So here's what it looks like on the
Ooh.
face. And here you can see it affecting the whole body.
Mm.
You can see what an amazing thing it was, and how they called it the speckle monster. You can see why there was so much fear about it. So as far as the development of the vaccine, it was developed by Dr. Edward Jenner. He was a doctor in England. And what he discovered, what he observed, was that milkmaids that milk cows would sometimes get cowpox from the cows. It was a very similar disease, but it was mild compared to smallpox. But if they did get cowpox, it was observed that they didn't then seem to ever get smallpox.
Huh.
So, for example, Jenner heard a dairymaid say, "I shall never have smallpox, for I have had cowpox. I shall never have an ugly pockmarked face." In fact, it was a common belief that dairymaids were in some way protected. So this intrigued him.
Yeah.
He thought maybe if somebody was given cowpox, they would become immune, because he had no immunity to it.
Mm-hmm.
So he did the first experiments in 1796. And he found a dairymaid who had fresh cowpox lesions on her hands and arms. He took some of the material that was oozing out of those sores, and he scratched them into the skin of an 8-year-old boy, James Phipps, who was the son of one of his workmen. The boy then developed mild fever and some discomfort in the axillae, which is the armpits. 9 days after that was done, he felt cold, lost his appetite, but the next day he was much better and he recovered. So then, now that was in May. Then in July, he inoculated the boy with smallpox, the actual disease. You think how brave that was?
Yeah. I don't think I'd volunteer.
Oh, no. And the boy didn't get sick.
Wow.
And then he did the same kind of a test on his own son. First gave him cowpox, and then later smallpox, and he also was protected. So that stimulated him to move on. This is how it began.
Yep.
And the whole story of the vaccine we can't go into, but it's fascinating. It wasn't accepted for a long time, the ups and downs, but eventually it was seen to be very effective and spread around the world, became mandatory. All right, so I want you to understand how threatening that disease was for centuries, and why then to have a vaccine work was embraced with such enthusiasm. However, now that was 1796. Look at, though, in 1916, for example, here's a quote from a doctor who was the vice president of a medical society, and he says, concerning the cause of this disease, and he's talking about polio, I think my professional brothers will be somewhat startled when I suggest that the present epidemic of infantile paralysis may have been caused by smallpox vaccination. This is clear back in 1916.
Wow.
He says, you smile, But why should the increase become epidemic in New York City and endemic throughout our entire country so soon after the wholesale process of vaccination started? Okay. He says it may furnish you food for candid reflection, since we know that tuberculosis has increased 300%, skin diseases 276%, and cancer 600% since the introduction of compulsory vaccination. So you see that even back then, after smallpox vaccination, the very first vaccine, already there was evidence that it caused susceptibility to other diseases. And it has continued that way ever since, though you don't hear much about it.
Right.
Okay. So let's go back to Jenner's work then, because it's interesting. I want to emphasize here, tuberculosis has increased 300%. That's what this doctor had observed. So we go back to Jenner's work. James Phipps, the boy he first did it with, died of tuberculosis at age 20. And his son, who was vaccinated more than once, also died from tuberculosis at age 21.
Wow.
See, but Jenner, I don't think, saw the relationship.
Right.
Okay. So, nonetheless, with the development of vaccination programs and so many large numbers of people being vaccinated, and very obvious improvement in not having smallpox so often, it was obviously working. And there were suggestions, like we just went over. I just gave you a little bit of it. There's lots of reports of problems associated with after the vaccines in some people. So why wasn't that accepted more? Because it was considered how terrible the disease of smallpox was. This was worth the risk. And that's the view of today. So even when, reports come out about, there are problems with vaccines, doctors will say there might be some, they're minimal, it's still worth doing the vaccine. It's still a much greater good. Does that make sense? You understand that?
Yeah, absolutely.
Okay. So let's look at some of the effects of vaccines in animals. We're still kind of mainstream view here. So, for example, in Purdue University, the veterinary school, they did several studies to see if vaccines could damage the immune system of dogs, if it could lead to life-threatening immune diseases. And they did this research because there was concern about this, obviously. They found that the vaccinated, compared to the non-vaccinated, developed autoantibodies, antibodies against their own body tissue, including fibronectin, laminin, DNA, albumin, all these things listed here. I know some of it doesn't make sense to you, but just get the idea that they did find there was a lot of autoimmune disease in dogs, not necessarily every one, but still a significant number. And I'll give you a little more detail on it. For example, when they had antibodies against fibronectin is important in tissue repair, multiplication of cells, growth and differentiation between the tissues and organs in a living organism. And the other one, the dogs that had antibodies against laminin is involved in cellular activities that are the adhesion of cells and tissues together, spreading of cells, differentiation of cells into different types, proliferation and movement of cells. And they say, in that what I copied here, vaccines thus appear to be capable of removing the natural intelligence of cells. Now, this is a report from a veterinary school.
Wow.
They also found that they reacted to collagen, and collagen, 1/4 of all the protein in your body is collagen. It provides a structure to our bodies. It protects the soft tissues, connects the tissues to the skeleton.
Yep.
It's no wonder that the canine health cancers of 1997 study of 4,000 dogs showed a high number of dogs developing mobility trouble after they were vaccinated. Okay.
Wow.
One more thing here in regard to cats. The AVMA, American Medical Veterinary Association, did a vaccine-associated feline sarcoma task force, did a study of 160,000 cats each year that, they did studies to find out why 160,000 cats each year develop terminal cancer at the vaccine information sites. How many of you have heard of that?
I have.
You've
Yeah.
heard of it? Uh-huh.
Yes, absolutely.
Okay.
Yes. And
The
I've
fact
seen,
the fact that cats can get vaccine-induced cancer has been acknowledged by veterinary bodies around the world, and even the British government has acknowledged it.
hmm
So it's known, but you don't hear much about it generally.
right.
In America, this was hard to accept. In America, in an attempt to mitigate the problem, that is, assuming that that might happen to a cat, they recommend vaccinating cats in the tail or
hmm
leg so they can amputate it when the cancer appears. Clever veterinarians, right?
It's terrible. That blew my mind when I learned that. I just was like, are you freaking kidding me?
No.
It's not. Yeah, that sounds like a really good plan.
Well, it gives you some idea. That's very brief, I know, but it gives you some
hmm
idea that there have been issues with vaccines from the very beginning.
hmm
And the issues are minimized because of the beneficial effect from vaccines. No question that they reduce the incidence of disease, but we're going to go into this on a deeper level now.
Okay.
We're going to go into what has been discovered because a lot of this investigation in this direction has not really been supported much in medicine. But in homeopathy, it was. And there have been further discoveries, and that's what we're going to talk about now. So can we go to the next file
Yeah.
there, which is the
Yes. Let's
mhm.
do this. Here we
Yeah.
go. Yeah.
So what's been learned, we call it, it's called vaccinosis. It's interesting that the word vaccination came from the word vacca, which is a Latin word for cow, because of
Oh,
cowpox. You see?
yes. Okay. Yes.
Yeah, it's interesting. That's where it came from. So
Okay.
vaccinosis was the name that was given to diseases following vaccination by homeopathic practitioners. So we're going to go look at that. So here's what we're going to cover, hopefully, if we have the time.
hmm
The discovery of vaccinosis by this Dr. J. Compton Burnett. What is vaccinosis? How is it transmitted? How does it appear in dogs and cats? And can a disease actually be eradicated with vaccines? That's what I'd like to cover.
Perfect.
So here's J. Compton Burnett. Here's when he lived in 1840 to 1901. He was a doctor that practiced as you see, he got his degree in 1878. And he developed a homeopathic practice in London. And for most of his career was an outspoken proponent of the homeopathic method because he saw such wonderful results with it. And he did several books. If anybody's interested that is interested in homeopathy or studying homeopathy, his books are very informative. And he talks about treating, for example, one of his books is treating children that don't develop properly, mentally or physically, treating cancer, treating cataracts. It's very interesting stuff. So anyway, he's
hmm
the one that discovered this, and he did after observing effects from the smallpox vaccine primarily. He did this book. This was published in 1884, and it's called Vaccinosis and its Cure by Thuja, which is a homeopathic remedy,
hmm
with remarks on homeoprophylaxis, which means prevention of the disease. And the primary vaccine he experienced was smallpox, but there might have been perhaps a little bit later some other ones. And you see here that on the timeline, in the 18th century, we had in 1797 the smallpox vaccine, but then in the 19th century, we had 1879, we had cholera vaccine, rabies in 1885, tetanus, typhoid fever, bubonic plague, and so on. So he might have had some experience with that, but he talks in his book primarily about the smallpox.
Okay.
So what is vaccinosis? I'm going to speak to this. This is from a understanding from a homeopathic perspective. And if those of you who don't know homeopathy, just bear with me. It's a system of medicine that was developed over 200 years ago by a doctor that discovered some principles, how medicines could be used to basically stimulate healing and displace the disease that was there. And the way it was done was to use a medicine that would produce a similar pattern of disturbance. And it was found that the consciousness of the individual could only focus on one at a time, either disease influence or what he called a remedy influence. So in other words, if you had a disease that caused nausea and vomiting, and then you gave an herb that caused the same kind of pattern of nausea and vomiting, that the attention would be given to one or the other, not both. And if the attention was given to the remedy, which he learned how to do, we don't have time to go into, but he learned how to do that, then the disease influence disappeared and the person became well. Okay. Now, one of the major discoveries that Dr. Hahnemann, who developed homeopathy, learned is that there's what he calls the life force. And it's an energy or a spirit-like, what he calls a spirit-like dynamic or an energy that operates the physical body. He said the physical body is just an instrument.
Yep.
It has no intelligence of its own. It can't do anything on its own. It's run entirely by what he called the life force, this energy that runs it. Okay. Now, here's what's relevant. I hope I'm not going too fast, Pam.
No, you're good. You're
Okay.
good.
I'm trying to get in as much as I can.
Mhm.
So what's relevant here is that as an outcome of that understanding from homeopathic perspective, that we human beings are basically an expression of life force. It's also true of dogs and cats. It's also true of plants. It's also true of viruses and bacteria. They all have a life force that's responsible for there being a physical manifestation.
Yeah.
All right? So, and that life force of the virus, so say if it's a virus, the life force of a virus that's responsible for a disease, it is what basically runs the viral, how can I put it? Its life, its growth. It's what makes a virus spread, reproduce itself. It's a living being.
The blueprint. It runs the blueprint.
Yeah, it runs the whole show.
Yep.
Okay. The physical expression, which is a physical virus, is part of it, but it's not really the dynamic that runs it all. It's the life force of the virus that runs it. Okay. So when a viral disease has been modified, what they call modified live virus vaccines, the virus has been grown in other animals so that it adapts to those animals and now no longer grows very well in, say, in humans or dogs or whatever it is. Then when it's put back into, say, the human being, it doesn't grow very well, but it does produce immunity. Okay? The physical expression of it was altered.
Yeah.
But the life force of the vaccine is the same. So when a vaccine is injected into a person or an animal, you are injecting the life force of the virus.
Okay.
So the disease is being communicated. Now, if it's a vaccine that's been modified, killed vaccine or modified live vaccine, it's been modified in such a way that it no longer manifests the same physical expression.
Yeah.
But you are transmitting the same disease. Does that make sense? You're manifesting the same life force. I mean, you're communicating the same life force of the disease that you're trying to protect against.
Yep.
So the disease has been changed, so it doesn't express in the same way. It's now very mild, perhaps, or very little evidence of it growing, but the life force is still communicated. So that when you have a mandatory vaccine program where everybody has to get it, what that comes down to is that everyone is given the disease. Whereas in a natural state, where there is an epidemic, not everybody gets the disease.
That's true.
But when there's a mandatory vaccination program, everybody gets the disease. You see?
Yes.
So this is why there's problems and health issues that follow vaccination, as discovered by Dr. Burnett. In other words, the life force of the virus or the life force of the bacteria, whatever is being used as a vaccine, though it may not communicate or manifest the same disease, which is people are very happy about, of course,
Yep.
nonetheless, it's going to have some effects on your health. It's
Yes.
going to manifest in a different way,
Mm-hmm.
though milder perhaps, but still it's going to have effect.
Yep.
All right. So let's look at some of that. Unless you have a question about this, did I make it clear enough?
No, I'm very clear.
Okay.
Yeah, keep going.
All
I
right.
think we're good.
All right. So let's look at then animal vaccinosis. So we're going to talk about how it looks in some animals. So I'm going to talk here first about distemper. Can you see the whole slide? It's cut off at the top of my screen, but it's okay.
Yeah, I think we can see it.
Okay.
Yeah.
So here are the symptoms of distemper as occurs in dogs. Okay. These are the natural symptoms, so to speak.
Okay.
All right. Not the vaccine, just the
Right.
natural disease.
Right.
A watery eye discharge, a nose discharge, conjunctivitis, which is inflammation of the eye,
Mhm.
vomiting, diarrhea, loss of appetite, watery feces, mucus, bloody, foul odor, severe fetid diarrhea. Fetid is very, very bad smelling
Oh,
diarrhea.
yep.
Spasms and seizures, paralysis of the legs, eruptions around the mouth at the hairline, swelling of the feet, red foot pads, pneumonia, skin eruptions, pussy lesions on the abdomen and inside the thighs, and emaciation, loss of weight. So those are the natural symptoms. So what I'm going to show you here, we're going to go through these. Over here are the same symptoms I just went over with you.
Mm-hmm.
And here is how it expresses in the dog as vaccinosis symptoms.
Uh-huh.
Now, a dog with vaccinosis won't have all of these symptoms.
Right.
It might only have one or two. That's the way vaccinosis manifests itself. It isn't going to, because there's going to be more in the next slide. But you can see now, maybe you've seen, those of you that had dogs that have had problems, you might recognize some of this. So one of them, the watery discharge from the eyes and nose. Well, dogs will have a tendency for watery fluid to drip from the nose.
Mm-hmm.
Conjunctivitis, where some dogs will have chronic eye inflammation with eye discharge, and entropion it's called, where the eye lid stick comes in. Vomiting, diarrhea, loss of appetite. They can have chronic gastritis, stomach inflammation, hepatitis, which is inflammation of the liver, of the pancreas, appetite disorders chronically.
Mm-hmm.
And then watery feces, fetid diarrhea, all this stuff, manifesting as parvovirus.
Yep.
It's a different form that distemper is taken.
Yep.
We'll get into that a little bit later. Recurrent chronic diarrhea in dogs, food sensitivities with diarrhea, and then the symptom of spasms, fits, and seizures, and paralysis of the limbs. You'll see dogs having epilepsy, really not unusual symptom, paralysis of the rear leg, and spondylitis, inflammation of the spinal cord.
Yeah.
All right. So those are vaccinosis symptoms. Okay, carrying on with distemper, eruptions around the mouth where the hair meets the skin of the lips, what's called lip fold dermatitis in dogs, or allergic eruptions on the face. Then we have swelling of the feet, red foot pads is a natural symptom. This is a rather common one. Some of you have probably really struggled with this, where the dog has this habit of constantly licking its feet.
Mm-hmm.
And they'll sometimes have eruptions between the toes, sometimes inflammation and swelling of the toes or the bottoms of the feet, and then inflammation of the skin between the toes.
Yep.
Then we have pneumonia, which appears now as kennel cough.
Mm.
We have eruptions of the skin, chronic skin eruptions of dogs, not uncommon at all.
Yep.
Emaciation, dogs failing to thrive,
Mm-hmm.
abnormally thin condition, and having very poor appetites.
Yes.
Does that make sense so far?
Absolutely. And I was just going to say that I know many clients also have seen similar symptoms like this in cats too.
Okay.
So, yeah, it can happen to cats.
Yeah.
It's
Oh,
just
absolutely.
something that they've
If there's time, I'll
um,
go into cats. We're doing pretty well, so
yeah,
maybe
yeah,
I'll have time to cover it. So let's go to
yeah,
the next one here. We're going to talk about rabies. This is a really interesting one.
yeah.
Rabies, I say, uh, you, s- it's usually more observable vaccinosis symptoms of rabies than with the other diseases. You can
Mhm,
recognize the other ones after you catch on to it, but
mhm.
rabies is sometimes pretty darn obvious
Yep.
because a not really nice little happy friendly dog gets the rabies and 2 days later it's very quite different. So here are
Mhm,
symptoms of natural rabies. So we have the restless and uneasy, apprehensive and vicious, avoiding company, or wanting unusual affection and attention because they're anxious.
mhm,
Desire to travel away long distances. That's a very common one. Sometimes you can't keep a dog confined, no matter what
mhm.
you do. They can't be restrained. If you try to restrain them with leash or something, they'll attack it. They'll bite themselves and cause severe wounds to themselves. They'll give out strange cries and hoarse howls, loss of appetite, no interest in food, unable to swallow, paralysis of the throat.
Yeah.
We have staring eyes with dilation of the pupils, or they can't close their eyes, the cornea dry and dull, hanging down of the lower jaw. The, the behavior of swallowing wood, stones, and inedible objects, a destruction of any blankets or clothing that's around, convulsive seizures, incoordination, throat spasms with severe pain, increased sexual desire, inflammation of the heart or disturbed heart function, and excited and jerky breathing. These are all symptoms of natural rabies.
Yeah.
All right, so let's do the same thing here. Here are the natural symptoms. So the restless, uneasiness, and apprehensive and becoming vicious, they appear as exactly the same way.
Mhm,
After the vaccine, they became restless. They are now suspicious of others. They become unfriendly to other dogs. They become vicious to other dogs and try to kill them.
mhm.
They'll be aggressive and mistrust strangers, especially people in uniforms.
Interesting.
Then we have dogs normally affectionate. They hide away and shun company.
Mm,
And we have changes of behavior to being very aloof and becoming going from affectionate to not affectionate. Dogs normally independent may become unusually attentive, and they can be just the opposite, very clingy behavior and fear to be left alone. You can't leave them in the house alone. Can't leave them in the car alone anymore.
yeah.
They follow the client all around the house. They always want physical contact.
Mhm,
These are things that follow rabies vaccine. Some of you may have seen it. The tendency to escape confinement and to roam. I already mentioned that, where they'll dig
mhm,
out from under a wall. You can't, they'll leap over it. They'll do anything to get away, and they'll
mm.
roam for miles. Any attempt to restrain them, they'll get hysterical and violent. They'll cause self-injury. And then this self-mutilation, they'll chew their tail and cause damage to it, chew off their toes sometimes.
Mm,
Very odd. And then we have the strange cries and hoarse howls. You'll notice after vaccination, some dogs their voice will change and become hoarse,
mhm,
and they have
mhm,
an excessive tendency to bark and be vocal. That's very common.
mhm.
The no interest in food becomes a chronic poor appetite. They're very finicky, unable to swallow because the muscles of the throat are now weak or paralyzed. And you can see dogs now sometimes after vaccination where they have partial paralysis of the mouth. They're sloppy eaters and drinkers. They have tendency to drool. Eyes staring with dilation of pupils. They have loss of sight, cataract formation, visual defects. Unable to close the eyes, the cornea becomes dry and dull. It's what's called dry eye,
Mm,
keratitis sicca. Swallowing wood and stones and so on. Dogs after a vaccination will start eating wood and stones and stick, and excessive desire to eat stool. Their
mm,
own stool and other animals.
mhm.
And then we have destruction of bedding, blankets, towels, clothing, and the same destructive behavior you'll see where they're kept in a kennel and they'll destroy all the blankets that are in there. And then we have convulsive seizures, muscular incoordination. We have seizures, epilepsy, chorea, twitches, and ataxia in dogs after being vaccinated. Epilepsy is a rather common one, unfortunately.
Can you tell people what ataxia means who may not know?
Yeah, trouble moving. They stumble,
Yep.
falling back and forth. They can't walk easily. They can't walk in a straight line.
Mm-hmm.
trouble using their legs and placing them properly.
Yeah.
They have pain and constriction in the throat and spasms of the throat, and it's called psychomotor seizure syndrome in veterinary medicine. It's seen as exactly that pattern.
Mm-hmm.
Increased sexual desire, you'll see that in neutered males even after vaccination.
Mm-hmm.
They start humping and trying
Wow.
to be aggressive. Inflammation of the heart muscles, a natural symptom. In dogs, you'll sometimes see them with irregular pulse or heart failure. And then this is an interesting one where the natural symptom of being of excitement and jerky breathing, or what's called cluster breathing, is seen in dogs after being vaccinated. They call it reverse sneezing.
Mm-hmm.
Okay.
Yes.
Doing pretty good. I think I'm going to go on here to, I think we have time to do panleukopenia. Is that what it says at the top? I can't see the top of my slide.
I
Yeah, I think
yes,
it is.
yes, that's right.
So this is cats. So here are the natural symptoms. And I won't go through all of them. Let's just go ahead and look at the table here. So
Okay.
the natural symptom of lassitude, where they are just lay around, they don't want to do anything, indifferent to people, other cats, or surroundings. This is a natural symptom of panleukopenia.
Mm.
Now you'll see after the vaccine, cats now become very lazy and do the same thing. They just lie around now. They don't have much interest. The second one is loss of appetite. Not unusual in cats. Appetite trouble, very finicky, doesn't want to eat well. People are always struggling with it. And natural symptom of fever. I've actually seen cats with chronic fever for weeks.
Oh, wow.
For weeks going on, never stopping. But they may not have very many other symptoms. They might have enlargement of the throat glands, possibly the lymph nodes. But this chronic fever, it's not very common, but I have seen it. The rough, unkempt coat is a natural symptom. You'll find cats that now become very poor groomers or never groom anymore. The symptom of dehydration, you'll see that sometimes in cats, leading to cystitis and bladder calculi. Rapid weight loss, what we think of as skeletal cats, they become very emaciated or become hyperthyroid. Cats that are now vomiting, the natural symptom of vomiting, profuse watery diarrhea. We now call it inflammatory bowel disease when we see it in cats after vaccination. Much mucopurulent from the eyes, fluid. Also a very similar thing with upper respiratory infections and sinusitis. Okay, good. Now, I want to go to, this is another point I want to emphasize here. On May 8th, 1890, the World Health Assembly announced that the world was free of smallpox because of the smallpox vaccination. And they recommended all countries stop vaccinating. And they say here, as you can see, the world and all its peoples have won freedom from smallpox, which was the most devastating disease sweeping in epidemic form through many countries since earliest time. Well, as we talked about, it was a terrible disease. This is an amazing result, isn't it? Don't we have to acknowledge that what Jenner did apparently eradicated smallpox from the world?
Interesting.
All right. More cases have been recorded since 1977. But here's, Pam, where we're going to go at the end of the branch together, okay?
Okay, let's do it.
Again, from a homeopathic perspective, what we understand about these viruses and bacteria, as well as, people and animals, how do we interpret this presumed eradication?
I think the first thing you look at is, okay, well, what has replaced it?
Exactly.
What other diseases and stuff are we dealing with now instead of that? So
let's look at it from this angle. Let me ask you.
Yeah.
Do you believe there is some kind of a phenomenon that we call reincarnation?
I do.
We die physically, but then we take a new form.
Yes.
Right?
Right.
Does reincarnation happen with just humans, or does it happen with dogs and cats and other animals?
I believe it happens to all living beings.
All right. Now here's the question, Pam. Ready?
Yeah.
Does it happen with viruses?
That's a very good question.
Yeah.
If we're going on the same presumption, that it's a life force, then I guess it is.
Yes. That's what I think is the I'm not putting down that smallpox was eradicated, but what I want to say, it's not eradicated in the sense it's now permanently gone. The life force of the virus takes on a new form,
New form.
a new disease. It may not be as bad a disease. Maybe it's HIV or something. I don't know, but still, it's not like gone from human experience. Not
Right.
this way of doing it. It might be possible for it to. We think. Well, we can't go into this. There is the idea in homeopathy that it might be possible that it could be actually eradicated completely. Even the life force could be eradicated. But let's leave it at that. We don't have time to go into that. But does that make sense to you at all?
Absolutely. And it also makes me think that, how our genes contain genetic material that has been passed down for generation to generation to generation to generation. So sometimes those things actually manifest in physical form in our lives, and sometimes we don't show any of that, and we keep passing it on to our offspring, right? So
Right.
that makes me think of that too. Like, maybe we don't see it, but it doesn't mean that it, somewhere along our genetic material, it's that memory still could be there. And maybe that's what makes some people more susceptible to getting certain diseases and other people not.
Yeah. I think really that what I wish to communicate is that our minds should be open to learning more.
Yep.
And there's a lot learned about viruses and diseases and epidemics and all that, which is wonderful material. But I think, for example, what's been done with homeopathy to find out there's more to it than we understood. We're going deeper into it. So I think from this, we could say, okay, that doesn't mean we should take from what we're looking at here and say, oh, vaccines are bad. We should say, let's move on. Let's find other ways that we can deal with this now that we understand it better.
Yeah.
That's what I'm trying to promote here. Okay.
Yes.
So we have probably we still have another 10 minutes or so. Okay.
Yeah.
Let me see if I have, I thought it might end here. Let me very briefly just do a little bit on this.
Yeah.
I just wanted to say how vaccines have increased in their use. Now that we've talked about vaccines and how they might be having effects that last a long time, even inherited. As an example, for me, I was born in 1941, and I received DPT and smallpox, 4 vaccines. Later on in 1954, polio vaccine came out. I got that one. And then a second one, the Sabin vaccine in 1956. So by the time I was an adult, I received 6 vaccines. And I don't remember if they were repeated. But in today's world, in the 2020 plus, a child by the time they're 2 years old has received 72 vaccinations.
What could possibly go wrong?
Yeah, this is very significant. So I said, I believe the vaccination method has been effective in reducing the incidence of disease, but there may be better ways to do it. Possibly, we could consider that. We have to consider also that there are some health effects might be associated with a vaccine that we have to know about and be able to deal with. All right. So that's pretty much what I said here. So I think we can stop here. We don't need to. I'm using in a slideshow that I did other places, so it goes on and on.
No,
so
you're good. You're good.
Questions, huh?
Well, one of the things that I think pet parents would benefit knowing is how T-cell memory records that information when a pet is vaccinated, when they are they're able to defend their bodies from the said, pathogen, bacteria, virus, whatever, right?
Yeah.
So is there a need to keep redoing it and redoing it and redoing it? And if not, why is that?
Well, what Pam's referring to here is there's 2 major. The immune system is amazing. It's just an amazing system, very complex in a way. But there's two major actions. If you have a natural disease, say you get a, whatever the disease is, it doesn't matter, flu or whatever, smallpox,
Yeah.
your immune system is going to react.
Mm-hmm.
There is a significant difference between bacterial infections, fungal infections, and viruses. Okay, bacteria like strep or staph or something like that,
Yep.
tetanus, the bacteria grow in the tissues, in the fluid around the cells. They use the nutrients, they reproduce themselves, and they can release some toxic material that kills the cells and so on. Okay, they live in the fluid around the cells. The virus lives inside the cells.
Mm-hmm.
So the immune system can't recognize them because they're only inside the cells. You see the problem? Mm-hmm. So what it's learned to do is that as a virus is growing in the surface of the cell is modified as the virus is growing to produce what we could, in current times, what they call the spike protein. These proteins are put out on the surface of the cell so the virus can use them as it leaves the cell and grows. And the immune system learns to recognize that. But the antibodies can't do anything about it. So they use a cell called a T cell, where they're killer cells. And what happens is the immune system acts, it moves around, the T cells move around in the blood and the fluid, and when they recognize that a cell is growing virus inside of it, it kills the cell.
Smart. So, it's smart. Our immune system is smart. It knows what to do.
Yeah. So there is a difference there. And that's also vaccines will do a similar thing, especially if they're modified live. Killed vaccines, not so much. Killed vaccines more focus on antibody because they don't really grow in the body. Anyway, let's not go there.
Yeah.
What you want to refer to is the
duration of immunity.
The what? Oh, the immunity. It's observed that a natural immunity, like if you get measles or mumps. I was going to say mussels, measles or mumps, for example, as a child. It's known that if you recover from it.
Yep.
You develop immunity. That immunity is lifelong.
Yeah.
That's well established in immunology. The same thing happens in dogs and cats.
Mm-hmm.
So if they're vaccinated and they develop immunity to distemper, they do not have to get the vaccine again. They are immune for life.
Thank you.
Now, if they didn't get immunity, you can repeat it, but it's not really doing such a great job.
Right.
Okay. So the repetition of vaccines is to a great extent is not necessary.
I agree.
Yeah, I'm just talking from the understanding of immunology.
Okay. And that has been studied for years, and immunologists have been shouting this from the rooftops for years, but there's very few veterinary ears out there that want to hear that. For probably
because they think that they think it's very possible that not every animal necessarily when I say that it's lifelong, I guess there could be some exceptions now and then of an animal that doesn't go lifelong. You know what I mean?
Yeah.
But I'm talking generally speaking, almost all of them have lifelong immunity. But the problem is some of the vaccines don't give lifelong immunity because they're not that good a vaccine.
Yeah.
Basically.
Yep.
So they repeat them. Also, it's it feels safer. It has other reasons for doing, financial and otherwise. So yeah.
Yep. We do have another question for you, Dr. Dr. Pitcairn. Jenny says, how can we undo vaccinosis? Is there one remedy that always works on rabies or a remedy that always works on panleukemia? What do you say to that?
No, there's not one remedy. The Suya, which is the one that was mentioned by Burnett, is one of the major remedies. It works in a lot of cases. But there are other remedies sometimes instead. And it's the same in homeopathy. It's the same process. Those of you who understand homeopathy know that what you do is you find a remedy that will produce similar symptoms. And that's what's curative. Now, it may be Suya, it might be sulfur, it might be silica. There are a number of remedies that are known to be effective against vaccination or vaccinosis. And so if you know homeopathy, what you do is you look at the symptoms of the animal and you pick the remedy that's the best fit.
Yeah.
But at the same time, I want to emphasize to you that homeopathy can cure vaccinosis very well. One dose can do it.
Yeah.
It's
awesome.
very, very effective in curing vaccinosis.
Here's another question. Do you need to use a remedy even if there are no side effects from a vaccine? Would it be beneficial?
No.
No.
But, you have to be observant.
Right.
You saw some of the things that were kind of subtle, like the watery nose.
Yeah.
If you weren't paying attention, you'd think there were no symptoms. But if you do start to see some symptoms, is it possible for people that are listening to this, can you download can they download the paper that
If
has
you
this
send
information in it?
if you send me, oh yeah, I have the chart. I can
Yeah,
put
the
that
charts.
in.
If they could download the charts, that'd be really helpful.
I do.
Because then they would know how to recognize it.
Mm-hmm.
But if you don't see any symptoms at all, the animal seems just fine. Not every animal or person is affected and develops vaccinosis.
Yeah.
Not all. No.
And sometimes it takes a while for them to start to show problems, correct?
Yes, it can be a few weeks. It can be in a few days as behavior changes. It's possible. I see that in rabies.
Mm-hmm.
But it can also be, as you said, a few weeks down the line, they develop a problem.
Yep.
And so it's good to remember that and be attentive to the possibility that the vaccine received may be a factor here. Yep. And it doesn't, in a sense, it doesn't matter, because if you're doing homeopathy, you still go by the symptoms that are present and find a remedy that matches.
Right.
To resolve it.
Rachel says, is the rabies vaccine necessary to repeat for cats?
I don't think so, though. I don't know that there's really been what could be considered adequate research to show that. You see, you imagine, if you're going to do that, you're going to study that, you're going to do research on that question, okay? How would you do it? You would take a number of cats. I know it's kind of a nasty thing to say here, but to do this to them. But to say you take 20 cats. When they're young, you give them the rabies vaccine. You then maybe you've shown that the vaccine's effective. Maybe by then a few, just like Jenner did. Like 2 or 3 months later, give them the rabies virus, and if they don't get sick, then you assume that they're immune. Okay, now to know if it's lifelong, we have to let them go for years.
Mm-hmm.
Live out, 15 years or so, and test them through their lifetime until you, at the end of their life, when they die, you can say, we tested them all along and they were still immune.
Right.
But nobody's done that.
Well, doesn't a titer test help measure that?
Titer is a test for antibody.
Okay.
You can have a positive titer and not be adequately immune to a virus because it takes the T cells.
Okay. Yeah. Okay. That's a good point. What if you were to do a titer test, like within 2 weeks of giving them a vaccine, just to see if they have if there are antibodies present?
Sure.
And then you wait and just see how they, see how they
live.
Well,
I certainly think you could do that with distemper or Panleuk or whatever.
Mm-hmm.
The rabies is a little more tricky, but because of its significance to us. But that's fine. But what I was talking about before is actually doing a scientific study to answer the question.
Yeah.
To look and see if there's a titer, fine.
Yeah.
But we have not determined if titer is sufficient. We've never done a study like that. We haven't determined how much titer you need.
Right. That's true.
Yeah.
That's true. Jenny says, and we have time for one more question. She says, not sure how to ask this, but how rabies caused Charlie's FHS, but we didn't know it until 1.5 years afterwards. Does that mean I missed the signs in the beginning and it just got worse? So if a cat develops a chronic illness that kind of shows up months, maybe a year later, I'm sure it's easy to overlook that you didn't notice those symptoms post-vaccination at the time because you just didn't know that was a thing, right?
Right,
So,
right. Mhm.
but
We
then,
look for that time association.
yeah. And so back to our original premise that that vaccines can contribute to chronic illnesses,
Mhm.
I would say that it's very likely that his chronic illness could have been linked to just too many vaccines, right?
Yes, to me, I would say from my experience that that's very possible, very likely. But again, you can't be certain about it unless you see an association. Like if
Mhm.
you get the vaccine, you see some changes in the health of the animal, say within the month, then it's pretty obvious.
Yeah.
If it's 6 months down the line, I don't know. You can't be certain. It may be very possibly due to the vaccine, but then on
Mhm.
the other hand, maybe there was some other factor. You see, so
Yeah, some
yeah,
contributing factors on top of
yeah,
that, like,
exactly, yeah.
yeah, exactly, like diet and flea tick
Mhm.
meds and,
Oh
environmental
yeah,
toxins and everything else. It's like a
right,
cumulative toxic burden we're putting into our cats,
right,
or dogs,
exactly. Yeah.
So I
Yeah.
think you look at the cumulative effect over all of those toxins, and it can certainly start to throw the whole immune system out of whack.
Sure, because the life force, from a homeopathic perspective, the life force is very, very powerful and maintains a healthy state unless
Yeah,
something interferes with it.
yeah,
Well, we're talking about now more than one interference. There could be the vaccine, there could be the diet,
mhm,
contaminated food, there can
mhm,
be emotional stress, right?
yes,
It
yes,
could be all sorts of things,
yeah.
and they all add up. And just as any of us would understand, the more things that coming at you like that, the harder it is for you to function.
Absolutely.
Yeah,
Absolutely. Oh my gosh, I cannot believe our time is already up. This has been so amazing and so interesting. I
I hope
really
so.
I we have a lot of good comments over here on the side. Just thank you so much for sharing your information, and this will be this will live on these channels so that you guys can go back and share this video with somebody that has a pet because they need to know this information. Any last thoughts, Dr. Pitcairn, before we say goodbye? Do you have like where can people find you? Are
Well,
you
I
doing
would
any
like to,
treatment?
I'd like homeopathy to become more accepted and used, which is not
Mhm.
really the trend. There's a lot of resistance against it. But I've been doing homeopathy for over 45 years, and I'm really impressed with it. And I think that we didn't have time to go into it, but you can use homeopathic, homeoprophylaxis. In other words, you can give a remedy instead of a vaccine and develop
Mm,
immunity to disease.
that's
You know,
amazing. Yeah.
yeah. So there's a lot that can be developed there. I wish it would be, but,
Mhm.
our culture is gonna have to change. It's a real right now, we're in a real cultural, um, problem, crisis, I don't know what you wanna
Mhm.
call it, that,
Yep.
we don't wanna give up our beliefs. We just don't wanna give them up.
Mhm.
And, until we are willing to open our minds and that's why I say at the beginning, let's not slip into making people good and bad. Let's look at how
How can
can
we
we
learn?
encourage people to look and to have
Mhm.
willingness to consider. That's what
Yeah.
we have to do, we humans.
Just be open-minded and be willing to learn something that you didn't
Learn
learn.
something.
Yeah.
Exactly.
Learn something.
To recognize the need to it. We need to
Yes,
learn more.
absolutely.
Yeah,
Yes. When we stop learning, we stop growing.
yeah,
So, and our pets give us opportunities every day to learn something if we are paying attention.
right.
So, anyhow, thank you guys so much. I just wish all of our viewers a wonderful Merry Christmas and Happy Holidays. And thank you again, Dr. Pitcairn, for being here to share your wisdom and teach us a little bit about vaccinosis. And I hope that pet parents will feel empowered to do better now that they know better. So, with that, thank you guys. We will see you next month. Have a blessed evening. We'll talk to you soon. Bye, everyone.
Bye.
All right.